I had a 40-year-old female and she comes in and she's in terrible abdominal pain. She is really distressed. And about the only thing this poor lady could say was hernia. The bottom line is ultrasound actually saved the day. Hi, it's Jonathan.
Hi, it's Emma.
And this is Cut to the Case. And Emma, welcome to Cut to the Case.
Thank you.
It's very exciting. Emma's our ultrasound expert, so no surprise we're going to be doing an ultrasound case. And we had a case, didn't we? I mean, it was pretty dramatic, and I'll take you through it because I found it pretty challenging, but I think the bottom line is ultrasound actually saved the day. So, and I was surprised at how useful it really was. So let's get into it. I had a 40-year-old female, and she comes in and she's in terrible abdominal pain. She is really distressed. She's holding her abdomen. She's really distressed. Severe central abdominal pain, and so much so that I couldn't really get a history.
Nothing.
It was really hard, and so we gave her analgesia. I examined her. You know, she wasn't really guarding. She was just sort of sore all over the abdo. Her vital signs, her heart rate was 120. Blood pressure was actually okay. She wasn't shocked. It was maybe 110 from memory. Oxygen saturation okay. We really didn't know what the history was, but she's 40 years old. She's got severe abdo pain. And I got you in, and you were standing by. Do an ultrasound for me. See if you can help. And I guess I wasn't really thinking what you might be able to find, but what was going through your mind is what you might find, Emma.
Yeah, well, I mean, my first thought in a young female with abdo pain was ectopic. So I went for looking for free fluid, kept trying to ask the patient if she was pregnant, but didn't really get a response.
No. I think the partner eventually came in and he said...
He did. He
probably
said...
not pregnant.
Yeah,
Well,
probably
that's
not.
what we thought.
Yeah.
But ectopic was the number one thing to look for.
Ectopic, and then I was thinking ovarian torsion because I think we also had a VBG and the lactate was a bit high. So that's kind of where my mind went. So sort of looking for free fluid and then looking to see if I could see a big ovarian cyst.
Which would, and you'd see the cyst and you'd imply it torted. That would be the
way. It would increase my suspicion of a torsion.
And it wasn't trauma. We knew it wasn't trauma. So we weren't doing the fast for trauma, which is what I would normally do. So we're looking for the ectopic. We're looking for the torsion. We don't think it's trauma. Any other abdominal things you could get a clue on in someone like this severe abdo pain?
Definitely. So renal colic would be the other one.
Yeah, of course.
So I was having a look at the kidneys, see if was there any obvious hydronephrosis, but her kidneys look normal.
It was all
as well.
Normal. And then abdo pain, and gave her some analgesia, reassessed her, and about the only thing this poor lady could say was hernia. And hernia. And then we thought, hernia. Okay, so whereabouts? So then you had a great idea.
Didn't really know any details about the hernia, and so I think she might have pointed towards her, umbilicus. So I was like, I'm just going to have a look with the ultrasound.
Put the probe on, and this is what you saw.
Yes.
So take a look at this. And Emma, do you want to just describe this image? Describe what we're seeing.
So this was just kind of just above her umbilicus, and I could see her abdominal wall muscles. And then there was just this really obvious collection outside of that, and I thought, that looks like a hernia.
And even I could understand that. So abdo wall, big pouch-like structure sticking out. And could you say, and so something's herniated, could you say what it was containing?
Yeah, well, the first thing I saw was there was fluid, and then I thought, that actually looks like bowel, and I could see, with live scanning, you could actually see... that it was obvious bowel. You could see the bowel wall, and then this collection of fluid around it. I was like...
So we had hernia, we had bowel, we had strangulated, incarcerated, whatever you want to say, hernia. So we had a diagnosis. So we had a start and we were on the way. So, and then we kind of felt it. We said, actually there is a tender golf ball size nubbin there. It was a bit hard to appreciate because she was in so much pain. So we had a hernia. So what happens next?
Well, we thought she's already had quite a bit of sedation, so...
And she'd been on ketamine, that's right. So we'd actually given her ketamine for pain relief.
Because morphine wasn't working.
So I think it was like, hell, let's just... And she was fasted, and I thought, well, let's just give her some more ketamine. Let's see if we can reduce it. So lo and behold, ketamine goes in.
She relaxed, and it was actually only really then that you could clinically really feel the hernia. And we reduced it.
And reduced pretty easily.
Yeah.
And I think at that stage the surgical team came down who we called, and you were able to show them this.
Yes, so we were able to show them the picture that I had saved of what we saw before, and then we re-ultrasound. We could see this where clearly this is where we had the lump
same
before.
spot, but no lump.
A little bit of fluid left over, but all of the bowel had been reduced.
Yeah. So look, and I thought that was just amazing, because it's hard to kind of prove to someone sometimes that you've done something. Now, surgeons are great, but was there a problem there in the first place? What were you going on? That kind of thing. No, we had photographic evidence, and I was really happy to see that reduced because now I was confident that she was okay. And eventually, as she came out from under the ketamine, pain's better. And look, we got a CT and we confirmed things were okay, and she did just fine. So, great case. I wondered, Emma, then it got me thinking, are there other things that ultrasound could be useful for in severe abdo pain? Are there other conditions you would look at?
So I think
and
definitely.
What might your approach be?
Yeah, I think always the first thing I'm looking for is free fluid, because even in a non-trauma patient, be thinking about particularly females, is it hemorrhagic cyst rupture? If you think about ruptured ectopic, obviously. So I normally look for free fluid, and then I'd be looking at the pelvis.
So when you say free fluid, you'd start up?
Yeah. Usually, so you're right upper quadrant around your liver tip.
That's where the fluid usually accumulates first?
Yeah, it's the most sensitive spot around the liver tip.
Yeah,
so
like in trauma.
Yeah, exactly. Same.
So you
you're
start
going to see
up
that
there,
first.
look for the fluid, and then go for where the money is. It's probably going to be a gynae pelvis thing.
Yep.
So move into the pelvis and
move
sorry,
into
go
pelvis,
on.
And then I probably look at depending on what history you've got. So where's the sore spot? Is it flank pain? You can look at the kidneys.
Yep.
Is there
kidneys? Yeah.
hydronephrosis, an obvious renal abscess or something?
Yes. Yeah.
And then you can have biliary. Have a look at the gallbladder. Is there obvious gallstone? Pericholecystic fluid. Obviously, in an older patient, AAA, which
AAA we didn't mention, and she's 40 years old, so unlikely. But I guess that's the other thing, isn't it? So, and then appendix. What do you reckon? What's the deal with that? I know there's a lot of stuff about ultrasound with appendix. Is that useful?
Yeah, I mean, it can be really useful if there's, if there is signs of appendicitis that you can see. Then obviously, that really helps you to rule it in. Doesn't exclude it if you don't see, if you see what you think is a normal appendix. So it can rule in, but not out.
So great. So look, I mean, that was just a great case and nice demonstration of how ultrasound really saved us. And then just to think a little bit further, how the other things that ultrasound could be useful for. And what I'm hearing is go for looking for fluid, because that's going to tell you there's something serious going on, and then think gynae, because that's probably where the money is, a cyst, an ectopic, and then just have a scoot around renal colic, which obviously can give you severe pain and even biliary pain. So fantastic. Well, thanks for that. That was really fun. And let's look forward to some more ultrasound cases on Cut to the Case.
Definitely.
We'll see you next time. Bye.
Bye.